We'll go ahead and get started. Thank you again for joining ACNJ's Getting Ready for the World Cup series. We have exactly a month until the World Cup arrives in New Jersey, and we're about to see a big increase in visitors, events, and activities across our state, which is exactly why we launched this series to help families stay prepared, informed, and ready to keep kids safe as things ramp up. Just a quick note about tonight's session. It will be recorded and shared with everyone after the webinar, so you can revisit it or share it with a friend. And after the presentation, we will have time for a short Q&A session that will not be recorded. So we encourage you to hold all of your questions until that time. Now, let's kick things off by introducing tonight's amazing speaker. Dr. Uzma Hasan is the Regional Director for Northern Jersey Pediatric Infectious Diseases within the Barnabas Health Medical Group at Cooperman Barnabas Medical Center. She brings extensive expertise in pediatric infectious diseases. Dr. Hasan is deeply committed to compassionate, family-centered care, guided by a simple but powerful philosophy. She treats every patient as if they were her own family. Please, everyone, join me in welcoming Dr. Hasan.
Okay, all right, let's get started. Good evening, everyone. Thank you, ACNJ, for this opportunity, and a special thanks to Echo for all her help in getting this webinar talk together. Today, we will be discussing keeping New Jersey families safe for the World Cup 2026. My objectives for the talk today are to review World Cup 2026 emergency preparedness, to go over common infections and mass gatherings and their modes of spread, and also to look at preventive strategies and how we can stay safe. I have no disclosures, so let's get started. So the World Cup 2026 is, as you know, the single biggest sporting event in the world. These games will be occurring June 11th through July 19th, and there are three host countries, the US, Canada, and Mexico. There are 48 teams who will be playing 104 matches over the 39 days of the tournament. And there is going to be an anticipated number of 6 million attendees. 11 major cities in the US will be hosting matches, 3 in Mexico and 2 in Canada. And there will be watch parties and FIFA fan festivals. So the MetLife Stadium, formerly known as the MetLife Stadium, now the New York, New Jersey Stadium, will be hosting these matches. And the capacity of this stadium is anywhere between up to about 82,500 spectators. This will be hosting the 8 matches, including the final on July 19th. The Lincoln Financial Field in Philadelphia is going to be hosting 6 matches. In addition, the information shared regarding team-based camps, which will be at the Pingree School, at Rutgers University, at Stockton University, and Columbia Park Training Facility. From what we know from the New Jersey Department of Health and New York City Emergency Management meetings, the team of Brazil is going to be in the Morristown area, Senegal at Rutgers, Morocco in Basking Ridge, Haiti in Atlantic City, and Ivory Coast in Chester, Pennsylvania. That's where they will be training. In addition, the Fan Hub is going to be at the Sports Illustrated Stadium, formerly known as the Red Bull Arena in Harrison, New Jersey. There is a lot of fan-related activities planned at the American Dream Mall, and flag cities, which include Bergen, Essex, Hudson, and Passaic counties, will have events June 8th through July 16th. The North to Shore Festival will be between June 13th through July 16th at Essex, Monmouth, and Atlantic counties. And then the South Jersey World Cup activations activities will be May 2nd through July 19th in Camden County. In New York, each of the boroughs is going to have a fan zone. The details are shared here. Concurrent events are America's 250th birthday is going to be July 4th. The International Naval Review will take place July 3rd to 8th in Port of New York and New Jersey. And this is going to be one of the largest maritime gatherings, which includes about 53 international warships, 60 tall ships, and 100 aircraft. And an anticipated almost 8 million spectators will be attending this event. the July 4th Macy's fireworks, ticker tape parades, summer concerts, and in addition, there will be other high density gatherings which may be planned or unplanned around this time. This shows you a timeline of all these events and the dates that are important and what is occurring when. This was recently shared at a FIFA Medical and Public Health Work Group meeting. So how does the system prepare for the World Cup and this massive event? The FIFA 2026 Medical and Public Health Work Group, which is co-chaired by the New Jersey Department of Health and New York City Emergency Management, was put together. The New York Department of Health has the NSPS, which is the National Special Pathogen System, and the NETEC, which is the National Emerging and Special Pathogens and Education Center, and in conjunction with the New Jersey Department of Health, has done full-scale tabletop exercises for mass sporting events, including those targeted at special pathogens. In addition, the health department has put together advisory documents, and these are designed for surveillance, for screening, and reporting tools. And many of the health departments across the country have worked together in conjunction. There's also regional collaboration between the state epidemiologists for situational awareness, in particular important for communication of any significant diseases circulating in an area because of the risk of spread. There is targeted trainings around cross-border outbreaks because the events are spread across 11 cities across the US. There is wastewater surveillance for viruses like SARS coronavirus, influenza A and B, for avian flu, for RSV, mpox, and measles. Surge preparation entails many things, and this includes preparing for large crowds, preparing for events that you would not anticipate would occur. For example, mass casualty events resulting from stampedes, things like that. The healthcare system prepares in terms of manpower and in terms of getting resources together. Food safety involves high volume food handling and handling that safely, keeping to strict guidelines for storage of food, like hot food must be maintained at 140 degrees Fahrenheit and cold food at 41 degrees. There are strict safety protocols, and there are accredited vendors who will be around the areas where these activities are taking place. There is communicable disease surveillance and response, and mass casualty planning, which may involve these 6 million spectators. So this includes multi-agency drills like police, fire, EMS departments working together. This includes hospital surge preparation. It includes getting ready for things like crowd stampedes, active threats, vehicle intrusions, things like that. And you heard an excellent talk on trafficking and security considerations for the World Cup last week. How do healthcare systems prepare? So the healthcare systems do their own surge planning to deal with high density crowds, have adequate staffing, have equipment available, be prepared for injuries, be prepared for screening for STDs, for those coming in with drug overuse, and having adequate manpower to support these activities. The healthcare system also looks into infectious surveillance, looking at what respiratory viruses are circulating, looking at foodborne pathogens, looking at vector-borne illnesses. The strategy of identify, isolate, inform for any pathogen of significance has been discussed across the healthcare system. And then we always need to keep in mind that an international visitor may have exposure to different pathogens that may be endemic in our area. We always inquire about their travel history, their vaccination status. Are they an immunocompromised host or an immunocompetent host? We also realize that they may require communication services or interpreters for us to adequately understand what symptoms they are having. The healthcare system also looks into resource management for personal protective equipment, for testing, and for post-exposure prophylaxis in case of a communicable disease that is preventable through vaccines and other strategies. And then there is extensive regional collaboration and communication across the healthcare systems. The New Jersey Department of Health has put together this wonderful document looking at the risk of communicable disease during these sporting events. And this is gathered based on surveillance of data from other sporting events and also based on the risk to New Jersey, New York areas. So measles is classified as moderate risk because of declining vaccination and also because of rising measles cases across the country. Enteric diseases, foodborne illnesses are always in the back of our minds, and there is preparation for safe food handling, like I mentioned. COVID-19 outbreaks have been reported in sporting events. And so that is currently COVID levels are on the lower side. And so that poses a low to moderate risk. And then Mpox is transmitted primarily through sexual contact or through contact with active lesions. And individuals at high risk are usually men who have sex with men. And this is reportedly a low to moderate risk. Other respiratory viruses like influenza, we are still seeing influenza B, but in lower levels. RSV is currently on the decline. There are other viruses that we are keeping an eye out for. And then vector-borne illnesses that are mosquito-borne or tick-borne, we keep an eye on reported cases, and also keep in mind that there may be visitors from outside who may be at risk for other illnesses like malaria, dengue, chikungunya, and so that is in our differential when they show up to the ER with fever and rash-related illnesses. Next, we will discuss infectious disease risks in mass gatherings. So transmission of infections can occur through various means. It can occur through respiratory droplets and aerosol. Respiratory droplets are usually larger particles and they go for a shorter distance. Aerosol are smaller particles which remain suspended in the air for a long period of time. And then there is fecal oral spread. They can be spread through direct contact. They can be spread from contact with contaminated surfaces or sharing of food and drinks or sharing of utensils. And there can be vector-borne diseases. The anticipated risk factors are high-density crowds, close dwelling conditions, host health status. So if you have an immunocompromised host, for example, a transplant patient would be at higher risk of picking up these illnesses. If they've had recent travel to an endemic area where something is circulating, that stays in our differential. We always look at vaccination status of the host, and we look at their shared facilities. Are they sharing their dwelling with somebody else, which would put them at higher risk? So let's look at respiratory infections. So COVID-19 outbreaks have been reported in mass gatherings, so have influenza. Currently circulating at higher levels is rhinoenterovirus, which is a virus that circulates around the summer and fall time and can give you diarrheal illness, can give you significant respiratory illness, especially in individuals who have chronic lung disease or are asthmatic, etc. Human metapneumovirus is also one of those viruses that can produce significant illness in those who are those who have chronic lung disease or ex-preemie babies or those with asthma or chronic lung conditions. MERS coronavirus is seen primarily in the Middle East area, and this is transmitted from camels to humans, and this can cause a very significant respiratory illness. So this risk of transmission of this is very low, but this is something that the systems are alerted to and watch for very carefully. Pertussis, which produces a prolonged cough, which is can be seen occurring. Pertussis outbreaks can be seen occurring every 3 to 5 years, and this is something that stays on our radar. Tuberculosis is something that has a longer incubation period, and this is usually from somebody who is having symptoms of fever, cough, coughing up blood, having night sweats, and exposure, which would result in symptoms developing in those exposed several weeks to months, can occur weeks to months out. Legionella is basically a bacteria that can contaminate cooling systems and water towers, and can cause significant respiratory illness if somebody inhales these contaminated droplets of water, and can produce illness, particularly in those who have transplants. It can cause significant illness. So basic prevention for respiratory infections for things like COVID, influenza, pertussis, vaccination is protective, hand hygiene, masking and distancing, and stay at home if possible when sick. A person is considered most contagious when they have a fever and they have severe symptoms of cough, runny nose, etc. Gastrointestinal infections are the next major thing that we keep an eye out for. Norovirus deserves its own discussion, so I'm going to talk about that in the next few slides. Amongst the bacterial illnesses that we keep an eye out for are Salmonella and Campylobacter. These are basically undercooked poultry products or unpasteurized dairy products that may be associated with this. Shiga toxin producing E. coli can also cause bloody diarrhea. So all three of these, Salmonella, Campylobacter, Shiga toxin producing E. coli, can cause bloody diarrhea. Shiga toxin producing E. coli can cause significant illness that can result in something called hemolytic uremic syndrome, where it can lead to renal failure. Listeria occurs from consumption of deli meats or unpasteurized milk and cheese products, and primarily soft cheeses. And listeria can cause significant illness in immunocompromised hosts. Thankfully, this is a very rare cause of GI infections. Hepatitis A also deserves its own discussion, so I'm going to talk about that towards the next few slides. Amongst other foodborne illnesses that we keep an eye out for are Clostridium perfringens, or things that can produce preformed toxin. For example, Staph aureus associated with Caesar dressings that are contaminated. And these can produce illnesses with nausea, vomiting, diarrhea, fever, abdominal cramps, etc. The key way to keeping safe is strict hand washing, disinfecting of high-touch surfaces, and for food handlers to not prepare food when they are sick or impacted with illness. And also safer choices of foods with certified vendors is a way of staying safe. Now, norovirus is a highly, highly contagious virus, and it produces abrupt onset of vomiting and watery diarrhea. The symptoms of norovirus can last anywhere up to 24 to 72 hours, and it is usually either fecal oral or vomitous oral spread. So somebody cleaning up an area which is soiled can actually spread the virus to those surfaces. And the annoying part about this virus is that it may linger on surfaces for up to about 2 weeks. And the conventional ways of decontamination may not work here. So typically it is advised to use bleach solution to clean surfaces. Those impacted with norovirus can actually contaminate food products that they're handling. So even things like ice, shellfish, ready to eat berries, salads, things like that can get contaminated. And usually treatment for norovirus is supportive, which is basically aggressive hydration and until the symptoms completely resolve. Norovirus outbreaks have impacted sports and several of them. So if you see the 2026 Winter Olympics, 2018 Winter Olympics, 2017 World Athletics Championships, the 2012 Youth Basketball Tournament in Kentucky, and the 2005 Premier League Football Tournament. And it is both the spectators as well as the teams who were impacted with this virus. So it certainly makes its presence felt. Next, we talk about hepatitis A in detail. Hepatitis A usually gives rise to a self-limited illness, which can be presenting with fever, malaise, jaundice, anorexia, vomiting, and abdominal pain. About a third of children less than 6 years will have symptomatic illness. That means the younger kids are less likely to have symptomatic illness. Older children and adults are more likely to have symptomatic illness. That means that they will present with jaundice. The incubation period for hepatitis A is anywhere up to 15 to 50 days. The way we diagnose this is with a blood test looking for hepatitis A IgM, and the treatment is usually supportive care. Those who are homeless or use illicit drugs or have household contact with hepatitis A, men who have sex with men, are at high risk for Hep A. Now, the vaccine is highly, highly effective at preventing hepatitis A, and 2 doses are given 6 months apart. The first dose of vaccine provides 95% protection. 2 doses provide 99% protection. And again, this is one of the viruses which can linger onto surfaces for some time. So all contaminated areas must be cleaned with bleach solution. Post-exposure prophylaxis or prevention is available with vaccine and when indicated, immunoglobulin to be given within 14 days of exposure. We always keep typhoid fever in mind when you have travelers coming in. Typhoid fever is usually spread from person to person and can cause severe incapacitating illness. This is an illness which is characterized by high-grade fever, chills, abdominal pain, and they can have headaches, they can have bloodstream infection, they can have constipation before they have diarrhea. Diagnosis is usually tests on blood and stool, and treatment is with antibiotics, and this must be treated with antibiotics, as opposed to the other strains of Salmonella, which may just resolve on their own, and we only treat the other Salmonella strains in those who are immunocompromised or at high risk of severe illness. Now let's go to vaccine preventable illnesses. The ones that we keep in the back of our minds are measles, hepatitis A, mumps, varicella or chickenpox, pertussis, polio, and meningococcal disease. Of these, the one that we are really concerned about is measles, and so that I'm going to talk about in detail in the next few slides. Hepatitis A we discussed. Mumps usually develops as a swelling of the salivary glands or the parotid gland, which usually will present as a lump under the neck. They can have a prodromal phase where they can have a flu-like illness. And the males who are infected with mumps can develop orchitis or swelling of the testes. This can also be a significant illness where they can develop encephalitis or swelling of the brain and other significant symptoms. Chickenpox is usually seen around the times of around winter, and so less likely to be a threat for this particular time of the year. Pertussis, we talked about, is the cough that is unrelenting and can persist in several stages for months and is highly, highly contagious. And those exposed to pertussis, usually close contacts, are given antibiotics to prevent transmission within the community. Polio is no longer endemic in most of the world, so poses less of a threat. Meningococcal disease is caused by Neisseria meningitis. Neisseria meningitidis, this is a bacteria that produces an acute onset of severe illness, and it is characterized by fever, headache, body aches or myalgias, and a progressive rash with sudden onset of multi-organ dysfunction. There are certain individuals with immune deficiencies who may be vulnerable. However, healthy hosts may also be vulnerable to meningococcal disease. And there are two vaccinations. One, which is the conjugate vaccine, which is against the ACY W135 strains. That is given 11 to 12 years, and the second round at 16 to 18 years. And then the second is the serogroup B vaccine, which provide protection. So let's go to measles. Why do we worry about measles so much? So measles is a highly, highly contagious illness with an attack rate of 90%. It is spread through droplet or airborne mechanism, and population immunity of as high as 95% is required to prevent ongoing transmission in the community. Note that many parts of New Jersey even have a lower level of vaccination or herd immunity that then is required to protect them from spread of measles. And the illness usually will present with high-grade fever. It presents with a thick coalescent maculopapular rash, which is basically extending from the hairline downwards. It can present with the 3 C's, which is cough, coryza or runny nose, and conjunctivitis. Individuals with measles are contagious 4 days prior to the onset of the rash to 4 days after the appearance of the rash, and the incubation period is anywhere between 6 to 21 days. The other scary thing about measles is that the virus can remain suspended for 2 hours in a space where a person who's infected has coughed or sneezed. So this one we are definitely very worried about. Now, complications of measles, 1 in 4 individuals can develop encephalitis or brain swelling. They can develop eye problems. They can develop ear infections in about 10% of individuals. They can have pneumonia, which can affect 1 in 20 cases, and then they can present with diarrhea in about 8% of the cases. Measles is associated with deaths in about 3 per 1,000 cases. The testing for measles is usually a swab, which is either an oropharyngeal or a nasopharyngeal swab, which looks for an RT-PCR, basically looking at copies of the measles virus. We can also test the urine and the serum or blood for measles antibody, and the urine is tested for the RT-PCR. Treatment is usually supportive. And remember, vaccination against measles, 1 dose protects 95%, 2 doses offer about 98% protection. The post-exposure prophylaxis, so say I was exposed to measles and I am not vaccinated, usually MMR vaccine is given within 72 hours of exposure, immunoglobulin within 6 days of exposure. To date, in 2026, the US has seen more than 1,800 cases of measles, and greater than 90% are in unvaccinated individuals. And New Jersey recently had a case in Hudson County linked to travel. Other things we keep in mind are skin and soft tissue infections that can be related to close contact, often seen in athletes, things like athlete's foot, which is treated with topical antifungal medication, folliculitis or cellulitis, which are infections caused by Staph aureus bacteria or can be seen with MRSA or MRSA bacteria, which are treated with either topicals for folliculitis or it is used systemic antibiotics for cellulitis. Things like molluscum are treated with cryotherapy and warts also, and these also can can spread because of contact with lesions. Next, we talk about STDs. So the around the World Cup, there have been in mass gatherings reported some high-risk behaviors, increase in drug intake, increase in alcohol intake, and unsafe sex practices, which may leave individuals vulnerable to STDs. Data shows that heterosexual males between ages 15 to 24 are most at risk. There's also an increase in requests for testing or after mass gatherings for things like HIV. HIV can remember present like a flu-like illness, swollen glands, other systemic findings. Gonorrhea, chlamydia can present with discharge, vaginal or penile discharge. Syphilis can present with lesion in the private area. It can also, when it progresses, present with rashes involving palms and soles. Mpox reported with the MSM population has been associated with initially a prodrome of flu-like illness, and then they can develop lesions, which are vesicular and pustular lesions, which are spread through contact. There is antiviral treatment available, and there is a vaccine available for protection against Mpox. So safe sex practices are encouraged. And there have been at mass gatherings easier availability of condoms and screening in proximity for those who are at risk or are concerned about STDs. Okay. The other thing that we worry about with mass gatherings is transmission of antibiotic-resistant bacterial infections. And in particular, there are certain bacteria that we track very, very closely. These include ESBL bacteria, carbapenem-resistant bacteria, Visa and Versa strains, We also track drug-resistant gonorrhea, tuberculosis, and salmonella. Why are we worried about these infections? Is because these infections are very, very difficult to treat, and they can be a considerable cost to the healthcare system. Let's talk about vector-borne illnesses. So the New York, New Jersey, Pennsylvania area is there is increased risk of tick-borne illnesses, in particular Lyme disease. Remember, the same tick may carry other rickettsial infections that we worry about. It may also carry things like Ehrlichia, Babesia, etc. And treatment is usually with either amoxicillin or doxycycline for Lyme disease. These individuals can present with fever, they can present with a bullseye rash, they can present with swollen glands, headache, muscle and joint pains, they can present with joint swelling. And then the EPA registered insect repellents with DEET or picaridin can be used for prevention. We also advise folks to avoid woody, brushy areas or grassy areas, and also do routine tick checks after they have been outdoors. We keep malaria on our radar. Remember that when we are having travelers coming in from the outside where malaria is endemic, they may be in the incubation period and may later present with symptoms which would make us concerned, like fever, severe headache, myalgias, chills, nausea and vomiting. They can have jaundice, they can have seizures. And diagnosis of malaria is usually with microscopy or rapid diagnostic testing. Treatment is usually artemisinin-containing compounds, and usually those who are traveling to high-risk areas usually are on prophylaxis. There are other vector-borne illnesses that we keep an eye out for. West Nile usually is through the bite of the Culex mosquito, which is present in the US, and usually this virus is found in when the mosquito infects birds. And individuals usually will be asymptomatic, but when they are symptomatic, they can have severe symptoms. For example, they can present with fever, headache, body aches, they can have nausea, vomiting, they can have pain behind the eye, they can have a characteristic rash, and testing is usually by testing the blood. There are individuals who can develop significant neurological symptoms with West Nile. Dengue is another one of the vector-borne illnesses which we keep on our radar. They can present again with fever, muscle aches, nausea, vomiting, belly pain, throwing up blood, and they can have multi-organ dysfunction. Now we go to the special pathogens like viral hemorrhagic fever, in particular Ebola. Remember that this is exceedingly rare, and this is usually through contact with contaminated secretions, body and blood fluids, for those who are infected. There is an animal reservoir, which is fruit bats, and basically this illness is highly contagious. So whenever the health departments are doing a run for unusual pathogens, Ebola is one that stays on their radar, and they want to be prepared for this one. Now, I know that all of you have heard about hantavirus and have questions around that. So I just wanted to say a few words on hantavirus. Hantavirus is spread from exposure to rodents, saliva, urine, or feces. And as you may have heard, on May 2nd, 2026, the WHO was notified of a cluster of severe acute respiratory illness in passengers on the MV Hondias in the Atlantic Ocean. And there were 2 deaths, which were a husband and wife, and there was 1 critically ill passenger. They were all confirmed to have hantavirus. The cruise ship had a total of 147 people, 86 passengers, and 61 crew members, and they were from 23 different countries. And as of May 12th, 2026, there have been a total of 11 cases, 9 confirmed cases, 2 suspected, and 3 deaths. The strain implicated for this particular hantavirus outbreak is the Andes virus, which is among the few strains that has a person-to-person spread. The symptoms for this strain are usually fatigue, fever, muscle aches, headaches, belly pain, vomiting, and diarrhea, which can occur anywhere between 1 to 8 weeks after exposure. And it produces hantavirus pulmonary syndrome, which is progressively deadly disease. There is another illness that can be produced by hantaviruses, which is hemorrhagic fever with renal syndrome, which is known more with the other strains of hantavirus. Transmission is usually prolonged close contact with the symptomatic person. So there is direct physical contact or exposure to secretions or handling of contaminated bedding, which produces transmission risk. And testing is with hantavirus serology treatment is usually supportive. As you may be aware, New Jersey is currently monitoring 2 residents, and currently they do not have symptoms. And at present, the risk of spread within New Jersey is thought to be low. This is a really nice table. This was an article put together by one of my colleagues, Dr. Keith Kay, a wonderful article that looks at significant infections or infectious disease risks associated with the World Cup and prevention strategies and what to look out for. And I believe that we have discussed most of these. In summary, the respiratory infections, GI infections, skin and soft tissue, waterborne, bloodborne pathogens, vaccine preventable illnesses, STDs, and vector-borne diseases are all that are catching our eye, and we are going to be looking out for these within the timeline of the World Cup and then shortly after. And then prevention strategies include vaccination. They include strict hand hygiene. Remember things like norovirus. It is better to wash hands as the usual sanitizer use may not adequately eradicate the virus. Masking when you're symptomatic with a respiratory illness. STD prevention is reduction of high-risk behaviors and using of condoms. Vector control using the EPA-approved repellents. Mosquito repellents or DEET sprays for tick control, and then enhanced surveillance are all ways that we can stay safe. These are some wonderful resources that have been put together by the New Jersey Department of Health. And these are my references. I wanted to give a special shout out to some of my colleagues, Al Fortner, who is the Director of Emergency Preparedness for Cooperman Barnabas Medical Center, Eileen Yaney, who chairs our infection prevention, and Brittany Helani, who is the Director of our library, for all their help. Thank you so much for your time.